I'm the Director of ICT. I'm Charles Yeomanson, here in the borough of Hillingdon. For those who are probably unfamiliar with the borough, it's the second biggest in London. It's on the outskirts of London. We serve a population of about 1/3 people. We've got an ICT strategy to move us forward, with the aim of being paperless at the point of care, in line with the government's vision for the NHS.
My role on the Hillingdon Care Record has been to interface with our existing systems, so we have integrated with our PAS, radiology and pathology systems, as well as implementing a documentation architecture.
The app consolidates a variety of clinical information from a variety of sources, all in the palm of the hand of the clinician.
We first started talking to Hillingdon a couple of years ago, very enthusiastic about introducing new technology to drive some real efficiencies within the organisation. We had a really good positive meeting initially, talking about our mobile technology, demonstrated the capability of what our M-Design platform can do, and from there subsequently started to work on the healthcare record project with them.
The best thing is just accessing all this information from a single platform, essentially. So right now we use multiple platforms to view diagnostic information, things like patients' results, scans, previous discharge summaries. It's just so handy having all this information accessible from one single platform.
Traditionally, staff would have to log into several different systems to see a complete picture of a patient record, whereas now we have all that information assimilated into one place.
So having an electronic record means that we can access that information very much more speedily, and we can focus our therapies and investigations in a much more succinct manner. We're able to actually populate our own information directly onto the system in a very timely manner. This allows for us to be able to review patients on a twice daily basis or on a daily basis and have up-to-date electronic records. We're not reliant on the paper records.
The benefits to staff mean that if patients arrive at A&E, some of them may be unconscious or not partly aware of where they are. The ability for a clinician to request a GP record means they've got an information about a patient's previous diagnoses and also a list of their medications as well.
I think with more and more clinical services moving out to a community-based setting, the increase in mobile technology is going to increase over the next few years, and that's something we wanted to invest in terms of a strategic platform that allows us to develop applications to respond to that changing setting and environment.
The app day to day does save me time because I can deal with a problem or a clinical query immediately. It's got a scanning barcode option where I can actually sort of scan the barcode in the patient to access, again, accurately the patient's data. I definitely feel that mobile working is a positive step forwards in patient care. It helps me more effectively manage patients. I feel that we can more safely manage patients by mobile working. It is definitely the way forward.
There is a big driver in the NHS to deliver efficiency and productivity, and mobile technology is a big enabler to that. So across the UK we're seeing lots of new projects around mobile. The clinicians and obviously the junior doctors that are coming through are now used to using a mobile device all the time for all aspects of their life, so why can't they use it in that healthcare role?
We're digitally mature in terms of our readiness going forward. We've also got the infrastructure now in place with our wireless network, additional storage systems, resilience, and we've got our development platform. The task ahead is to develop the capability, and we've got identified various gaps, and we've got a programme in place to develop our systems, which will take us to 2018 to deliver paperless working for clinicians at the point of care.